Hello, so I'm here to talk about nutrition science and applied nutrition. Those are our two nutrition majors here at NC State. My name is Dr. Cooke and I'm the undergraduate teaching coordinator for the nutrition program. So if you are interested in nutrition, take a chance to come and meet with me. I'm happy to talk to you about those options. But today will be an opportunity for you to hear a little bit more about what nutrition is and what it might some different types of careers that you could pursue after your time at NC State. So to start off, nutrition is a science. I think a lot of us tend to think of this picture over here, where we tend to think about nutrition as only a means to weight loss, but rather nutrition is this extremely complex system where it connects physiology and it connects anatomy and biochemistry and chemistry and all of the information from your prerequisite courses to be an applied science. So we see here nutrition science really is about what really is happening in the body with a scientific principle. Okay, so we do focus some on the applied aspect of nutrition in that we do nutrition counseling as nutrition professionals in some cases, and there's also the science behind that. So as I mentioned, we do have two major options. We have nutrition science and we have applied nutrition. So nutrition science is all for those who think they want to go on into one of the fields where they will need 4 semesters of chemistry and 2 semesters of physics. So for those of you who are pre-med, you think you want to go to pharmacy school, veterinary school, maybe you want to be a physical therapist, that's really going to be the track you want to take because it'll give you those prereqs that you need. Okay, so that would be the nutrition science route. For those of you who are thinking about maybe going on into nursing or PA school, or to go on to get the graduate degree to become a registered dietitian, then you would want to be going towards the applied nutrition route. And so applied nutrition is really designed for those who are going to go on into more of the applied sciences, public health, maybe you're going to go on in nutrition science as a field. And so that removes one of those semesters of chemistry and both of those semesters of physics, and what it allows for you to do is really tailor your what we call application electives to your future career. And so that might be, you're going to go on into PA school, so you want to take another round of anatomy and physiology. It might be that you want to go on into public health, and so you take an agroecology course or a global public health course. It could be any one of those options. It also makes it easier for you to pick up a minor in something like sports science or psychology, maybe even a nonprofit minor as well. So I think it's certainly useful to know what that end goal is going to be for you. And yes, you just got here on campus and you're thinking about what you're going to major in, but it's also helpful for you to think about that end goal. What do you think you want to do when you graduate? And that can really help you figure out how to tailor your coursework accordingly. And so we have a list here of some of those alumni profiles. And so we've had students who've done a variety of different things. They've gone on to become dietitian's assistants here at NC State, some that have gone on to be high school teachers in the science realm. Those who've worked at nonprofit organizations both in the Raleigh area as well as throughout the nation with some programs, even those that reach internationally. And so those are things that you can do with a bachelor's degree coming out in nutrition. You could go on into clinical research, a variety of different options there. But then many of our students either use that as an opportunity to go on into professional school or some other option there. And so this is a list of a whole bunch of other nutrition and health related careers that require some additional training, whether that's an additional 2 years to 3 years for graduate school, or for those who are going to go on into one of the 3 or 4 year allied health programs. But I think it's really helpful to be able to not just hear from me, because while I am an alum of the program, and that is one track that you could take going into academia. It is important to hear from other alums, and so we do have a series of these videos that we've created. If you go on into our major and take our Nutrition Research, Communication, and Careers course, you'll see a lot more of these. I'm also happy to send you a link. But we'll start off by hearing one of these videos from a student named Hillary, who is actually graduating from medical school in 2017. She's one of our alums, and she will be going on into her residency. So we'll watch this video.
So my story at NC State started with kind of a general interest in health and nutrition, and so naturally I went for the biology major, and then realized quickly that there wasn't a lot of nutrition within those courses, and so I set up a meeting with Dr. Ash and took her 301 class and fell in love, and so that's kind of where my nutrition journey got started. And then after that, I realized that this is a really cool thing and how applicable it was to my everyday life and everyone's everyday life. And I knew that I wanted to do something possibly in physical therapy or medicine later on in my career, and so how just useful information this is for your patient's health and well-being. And so I started to seek out other opportunities, including undergraduate research in the nutrition department. And I knew that I wasn't a bench top person. Bench top is great experience, but I knew that I was going to have to do something a little more community-based, and got in touch with Dr. Goodell and started doing research related to children's fruit and vegetable preferences, and developing a tool in order to see how we could assess that and best assess where education needs to go within a toddler population, and absolutely loved it. I actually ended up deciding on medical school, and I was excited to be able to use the nutrition knowledge that I learned at NC State in order to educate patients in the future. And I was excited about the idea that you could empower someone to make those choices themselves, and having the knowledge here that I gained at NC State would allow me to do that. I continued that passion with the development of a children's book called Where is Henry? So Where is Henry is about a little girl, and she take her favorite snack, they're carrots, and just like Henry's, and so it's her day to play with the class bunny, and she gets to school and the bunny's missing, but she had a healthy snack, and her two other friends that are main characters in the story, their snacks weren't as healthy, so when it came to chase Henry on the playground, she was able to be the hero of the day. It can be a classroom or a PE classroom, and they can exercise while doing the story, and then at the end we tie it up and talk about the healthy snack moral of the story and how they incorporate those things into their daily lives and the importance of daily activity. So when the kids are all running within the story, it's a great way hopefully to get children excited about reading and exercise, and these things called carrots and how they're awesome, and vegetables and fruits, and just hopefully and hoping that they'll take that home to their families as well. So my current job is being a medical student, and I love it. So now we just started our rotational year. It's the third year, and I've loved every minute. You're always in a diverse situation. It never gets boring. So I have done my pediatrics rotation and currently on OBGYN, and even in just those two rotations, seeing how nutrition plays a role from the young age to this mom's getting ready to have a baby and she wants to change her diet because she wants to be healthy for her baby. I think when I get farther within my training, I'll figure out what it is that allows me to do the things that I love on a daily basis within the realm of medicine, and then also have that nutritional education component. My typical day, it varies. It starts usually fairly early, so it can start as early as 5, or it can start, a little later, late in the morning of 7:30 or something like that. But so I'll go to the hospital and we'll round on patients, and that just entails going around, checking in with them, see how they're doing, come up with a plan for them, and then based on the rotation or based on if we're in surgery, that might be a full OR day, and so you're in the OR all day. Or you might be in the clinic all day, which is really fun, which is when you get those educational opportunities, which I love. So it really varies, but it's always interesting and it's never a dull moment. Using nutrition in my daily work life is a very frequent thing, and more so than I thought it would be. It's great to have that fundamental knowledge to go in and talk with a patient about. They have basic questions about, well, what do I buy in the grocery store that's the healthier version of bread, the brown bread, what is that? Well, I can talk to them, and I have the skills to educate them on those choices, and so that's a really neat thing for me as well, and I attribute to my education here at the nutrition department. What I learned about myself after graduation was I learned how much that I didn't know. There's always something to learn, and I think keeping that perspective keeps you humble, and it allows you to seek opportunities to be a problem solver. And they're not problems. I like to think of them as opportunities, because they are opportunities, and they're opportunities to find out what you're passionate about, whether it's related to nutrition or some subset of nutrition or science, and finding a problem and solving it. Find out what you're passionate about, and you may not know what that is, and that's a really daunting task. But to try new things and seek out opportunities to determine what your passion is, and really focus on that, and not so much of, yes, you're going to get a wonderful degree from NC State in nutrition, but there's so many things that you can do with that, and really focusing in on how you want to do that and how you want to put your mark on it. Do the things you're passionate about, because that comes through. You can have an awesome resume and then in an interview not convey the conviction and the passion for the things that you do on a daily basis if you don't do things for possibly the right reasons. And I think life is a lot easier, and you'll have a much more rewarding life if you do it, if you enjoy it. So just really keeping in mind what you're passionate about, what you look forward to get up and doing every day, and using the wonderful resources that you have around you right now. So it's really a blessing.
Okay, so you just had a chance to hear from Hillary Spangler, who was able to combine her passion for nutrition research with her future in the medical profession. And so Hillary was able to use her background in nutrition not only to help her patients, but to help with community outreach as well. Okay, so that brings us into what kind of courses are you going to take in nutrition? And so really, there are 4 core courses that you would take in your courses here at NC State, and then the rest are going to be options of things that you would take, what we call nutrition electives. So these 4 core nutrition courses, first of those is Intro to Human Nutrition. Some of you may actually be in this course this semester, either online or in person, or some of you may have it on your schedule for this upcoming spring semester. And so this is really the course that teaches you about all of the introductory topics relative to nutrition. We go over the macronutrients and micronutrients. We talk a lot about different types of scientific studies and how to be able to critically evaluate some of those claims relative to nutrition. And then you'll follow up that course with an Intro to Nutrition Research, Communication, and Careers course. And so this is really designed to help you transition from the introductory course into some of our upper level courses, where you'll be expected to read literature and be able to figure out what it means, so be able to interpret it and be able to evaluate to find out if it was really a good study or if there were many limitations that stand in the way of you being able to take their conclusions as scientific fact. And so that course will teach you about the different types of research that we do in nutrition, teach you more about communicating in a scientific way, both verbally and in the written form. And then also talk a bit more about different career options to help you make some real and tangible goals moving forward, to be able to figure out what kinds of internships and experiences you need to get you in that spot in the future. Then our 401 Advanced Nutrition and Metabolism course is a biochemistry-based and physiology-based course that really brings together all of your science courses and your key nutrition courses to be able to look into some of the metabolism in the body. And then you typically take that in your junior year. And then your final semester, you'll take that nutrition capstone course where you'll work in teams of 4 to 5, come up with a research topic and be able to implement that research, do a research analysis of that data, be able to present it both as a poster presentation at the end of the semester as well as a scientific paper. And so students have done a variety of different topics. This past semester they did some qualitative work looking at specifically some of the lactation consultants' thought processes behind being able to provide support. We've had students who've done surveys with students at the gym about pre-workout or post-workout meals. And we've had students who've even looked at cartoons to look at the information relative to the types of nutrition options that are featured in kids' cartoons. Okay, so those are those core courses. But then there are a whole host of nutrition electives. And so whether you're planning on majoring in nutrition or maybe you're considering a minor in nutrition, these are some courses to keep in mind. We have Eating Through American History, we have Food and Culture, so both of those go into cultural aspects of eating and meet some of those GEP requirements. We have a nutrition education course that is really good for those going on into health professions because it focuses in on pre-planning, planning, and implementation of nutrition education, but also on behavior change, which is a really important part of being a healthcare professional. Maternal and infant nutrition for those who think they want to go on into some realm of health related to infants and babies. Maybe it's going to be pediatrics, maybe you want to be a lactation consultant. Human nutrition and chronic disease, which is really great for those who are interested in learning more about those chronic diseases and thinking about going on into one of the health professions. You get to do a paper in that class where you get to explore a specific chronic disease and the literature surrounding that. In our applied nutrition education course, we do service learning in the community and life cycle. We look at pre-pregnancy all the way to geriatrics, where you get to learn about those nutrition requirements in a case study based way. Lactation and milk and exercise as well are some of our specialized courses like maternal and infant, where we focus in on one specific topic relative to nutrition and allow you to dive deeper into that, as well as nutraceuticals, which is kind of that intersection between food science and nutrition. So we have a variety of different options. Like I said, if you're rather interested in the nutrition minor, you could take some of these courses, but then with a nutrition major, you will get to pick a number of these courses that fit your interests. We also have a variety of what we think are specific things that make our department unique. Certainly you've heard from a lot of the different programs, but we do have a direct application of your science-based learning to the realm of human nutrition. So for those of you who are interested in moving on in the health professions, this is a good way to be able to dive in deep to an applied part of science. Okay? We do have a lot of opportunities for you to interact with faculty, both in the classroom. As I mentioned, a lot of our classes involve group work and involve case studies, a lot of in-class activities to help you get to discuss with your teammates as well as your instructors, as well as the opportunity, I'll mention it a bit, some options for you to do some research or community engagement with one of those faculty members. But for those of you who are thinking you want to major in human biology, I do have to tell you now that you can't double major in nutrition science or applied nutrition and human biology. So we found that they're very, very closely aligned, and you would say, well, it might be really easy for me to do that. Well, that's exactly why we don't let you do it, because if it's too easy, it's not meaningful. Okay, and so if you are deciding between the two, we are going to ask you to make a decision between biology or nutrition. Okay, but you could always do a nutrition minor if you were planning on majoring in human biology. Okay, but you can do a double major with any of those other life sciences curriculum. So maybe you're thinking microbiology, or maybe you're thinking biochemistry, and you want to combine nutrition science with that. We can talk to you about how to make that happen. So then some of you are saying, well, I want to take a couple courses in nutrition, but I don't want to major. That's perfectly fine. We do have the minor in nutrition. That is an option for you to be able to dive in deep, take 15 credits relative to nutrition. You take that introductory nutrition course, and then you pick some of your electives, both at the 200, 300 level and the 400 level. Okay? So for those of you who might be interested in animal nutrition, there are some animal nutrition courses there in the minor as well. Okay, so that, and it might also meet some of those elective requirements for some of your other life sciences degrees. As I mentioned, we have a variety of different research opportunities going on. They span from lab-based research, working on human milk, or looking at glucose response to different foods, looking at different markers relative to diabetes, to more of our community-based programs, where you have an opportunity to be able to go out and do interviews with preschoolers, or to be able to do interviews with healthcare providers. We also have what's called Scholarship of Teaching and Learning Research, where some of our faculty focus in on the student learning experience. And so you could do a teaching and research related project where you're TAing for a class, but you're also developing some type of tool and evaluating it as well to be able to help benefit your fellow students as well. A lot of these classes are, your courses are focused on human nutrition and application, and that's exactly what our research focuses in on. So whether it's preschool education, elementary education, maternal and infant nutrition, international nutrition, or the college student experience relative to nutrition education, tons of opportunities there. We also have a whole host of internship opportunities. We worked really hard to develop these partnerships with both partners on campus as well as in our communities. And we highly encourage that, because that's really where you're going to figure out if that's something you want to do for a short period of time, or if it's something you want to pursue for your career. And so we have dietitians here on campus. We have dietitians out in the community where you can work with them. We have partnerships with open door clinics and other free health clinics in the area, as well as opportunities to be able to do other nonprofit type settings. And so we want to help you, whether that's on campus or in some other community, to be able to help you to gain that experience. Okay. So you're saying, well, now I really want to major in nutrition, and what do I need to do to get there? Okay, and so what we want you to do is to be able to make sure that you've got a good solid foundation in those basic sciences. Okay, so we're talking about those Chemistry 101 courses and the first of the biology course, the Bio 181. We want to see that you've been successful in those courses so that we know you can be successful as you move on in your coursework. Okay, and so we would like to see a B or better in one of those courses. And then if you do have an opportunity to take our Introductory to Nutrition course, we would like to see a B or better in that class as well. So this can be a good way to test out to see if you like nutrition as a discipline. You might get into the course and you say, I'm interested in something else, or you might say, this is the coolest thing ever, why did I not know about this before? Which is what happened in my case. Okay, and so we want to see that you have been able to be successful in those courses. Okay, and so if you have questions moving forward, feel free to reach out to me. I will share my contact information here as well. Go back to the first slide. Here you can email me or come by my office in Schaub Hall. Happy to chat more with you. Thanks for listening.